Well, friends, welcome to today's webinar. And today we have with us Dr. Anshu. She is a professor in Department of Pathology at Mahatma Gandhi Institute of Medical Sciences, Sevagram. She is a FAMER Fellow from CMC as well as Philadelphia. And she is and the background in almost every medical education related event in the country, whether it is national, she's secretary, ex-secretary of the Academy of Health Professional Education. She'll be presenting on case-based learning in pathology. Over to you, Anshu.
Thank you, Sanjay, for the generous introduction. Sanjay and I were both the same batch when we joined the FAMER CMCL fellowship. My foray into pathology happened because I fell in love with Stanley Robbins' prose. And I strongly believe in what Robbins says, that pathology cannot be learned until there is a clinical context to it. So it was quite natural that when I took up CMCL FAMER fellowship, I chose the topic of case-based learning in pathology. Later in life, when I went on to do my master's in health professions education, I was lucky to get enrolled in Maastricht University. It is one of the premier institutes in the world. It's in the Netherlands, where the entire training happens through problem-based learning. And that opportunity opened a window to the world for me, where I learned that when you make learning student-centered, when you make learning active learning, then the pleasure of learning almost quadruples, and it is no longer that boring task of sitting in the lecture hall and listening to a teacher passively. So I am a strong advocate of case-based learning, and that is why I insisted and asked Sanjay that I would like to take this session. From what we know, that those of you who have enrolled in this course, you have already been introduced to the changes in the new competency-based medical education curriculum, and you know what the changes are for the second MBBS in pathology. You've already learned about competencies and have begun writing the specific learning objectives. Today, we move to the teaching methods. Yes, we all have to shift to small group teaching because that is what the MCI's mandate is. And one of the ways of learning, of using small group teaching is by case-based learning. Now, this is a cartoon you have seen very often if you've attended any of the medical education workshops. So yes, we all presume that we are teaching and we are teaching well, but it is a question to ask yourself that whether the students are also learning. So, and a very favorite picture of mine is this, which shows very clearly that teaching and learning are merely reflections of each other, and it is the way you see the world. So I'd like to start first by gathering information about what your understanding of case-based learning is. So you can use the chat or you can raise your hands and Sanjay will give you a chance to answer what you understand by case-based learning.
Your hands. I don't see any hands.
So if you're embarrassed about raising hands, you can always use the chat and tell us what you understand by case-based learning.
Yes, now there are hands. Dr. Bindu.
Yes, Dr.
And Dr. Shagufta.
One by one, yeah.
Good evening,
yes,
ma'am.
Yes, Dr.
Good evening, ma'am.
Good evening.
Sorry,
please
that's Dr. Shagufta. Anshu. Case-based learning, it's where we create clinical scenarios and we construct the case in such a way that there are
there's a lot of disturbance here, so if you're not speaking, please mute your audios. Dr. Shagufta, please go ahead.
Yes, ma'am. Case-based learning, it basically has clinical scenarios. It's a case with a clinical scenario, which we construct around different, keeping different things in mind. For example, we may introduce terminologies, we may introduce investigations, and we may introduce clinical presentations, features, signs and symptoms, and then we may use other parameters in constructing the case so that and integrates certain findings about pathology such as gross and microscopy copic findings, and then try to judge whether student is able to correlate and make sense of integrating the basic with the clinical and have a judgment on clinical judgment about what the most likely diagnosis could be. That's what I understand.
Right. Yeah, thank you. Any other volunteers who would like to add to it or maybe change something
Dr.
to what
Bindu,
Shakta said?
Bindu, can you speak, Dr. Bindu?
Yes, sir.
Yes.
Please go ahead.
Hello. Am I audible? Am I audible?
Yes.
Yes.
Hello.
Yes, you're
Yes.
audible.
So I'm supposed to tell you all what I understood from the case-based learning. Is it so?
Yes.
Okay.
Please go
I think
ahead.
I would also agree to the I would also agree to what I've been hearing to by the previous speaker. We also give CPC questions after each chapter, which is like a clinical scenario incorporating the clinical findings as well as the pathology into it, and then we try to discuss different scenarios which get covered in that particular chapter. I think that's what I understood about the case-based learning.
Okay. Thank you. Anybody else would like to? We can take one more.
There are a large number of answers on the chat.
Okay. Can you read some of them out or just compile them?
Learning with Dr. Sharmila Dodani, learning with an actual scenario in mind. Astitva, problem-based learning. Sharmila, patient scenario. Then Dr. Barnick, CBL is using clinical cases or vignettes to explain a theoretical concept. Sharmila Dudani is student is made to learn everything about a topic around the patient. Then Bindu Rani says, like a case of pleural effusion, give clinical symptoms scenario, then introduce about pathology. Then Dr. Tejas Choksi has also raised his hand.
We can take one more response here.
Okay. Yes, Tejas. Tejas, Dost Muhammad Khan.
Yes, sir.
Yes.
Thank you, sir. Sir, apart from this, previous speakers, there will be some images can be added, like an X-ray. Apart from that, after finishing this structured case-based scenarios, some specific learning objectives, some 5 to 6 questions will be there for each case.
Right. So thank you, everybody. Let me proceed now. From what you all told me, you all are talking about learning being organized around the case. So that clinical case or that clinical vignette will be the trigger or the starting point around which all learning takes place. So you're providing a clinical context, which is the hinge on which your entire understanding will depend. Just a minute, the slides have got stuck. Right. So basically, when you're talking about case-based learning, the case or the problem, as they usually call it, are the starting point for the acquisition and the integration of new knowledge. So this is the trigger. So why do we need to shift to case-based learning and not stick to your lectures in the classroom? The reasons are many. There is a lot of evidence which shows that using this kind of a case and allowing students to learn around it, it promotes deep learning, rather than the rote kind of learning or the cramming or surface learning or memorization, because you're letting students understand the intricacies or the mechanisms or the pathogenesis of how some things happen. And secondly, the moment you use a clinical scenario, you are making a pathology relevant to students. So, can all of you please mute your audios? There's some disturbance coming here. So, when you contextualize learning, it makes it more relevant, and then the subject, which is so-called paraclinical, so-called not clinical, it becomes more relevant. Students understand why they are learning something. It's depending upon the case that you design, you can use it to enhance analytical approaches and critical thinking. And because they are applying that knowledge, it improves retention. So the other aspects of case-based learning are that students usually learn in small groups when you talk about case-based learning. And this is a learner-centered method. It promotes active learning, where the student is free to explore with the material which is available, and form their own knowledge, construct their own knowledge. And this, on the sidelines, you will see that this is a teacher here. He's not sleeping. He is here. He's in a more passive role because the activity is by the students, and the teacher's role here is only to facilitate the discussion. So this kind of discussion, the hidden agenda is it promotes collaboration. It gives opportunity for students to learn more about teamwork, which is essential for every medical graduate. Now, the plan for these webinars, there are three aspects to case-based learning. The first is how to construct the case. What is the design of the case? Second is the implementation issues, which involves how will you train your faculty to conduct these sessions, and how will you train them to facilitate? How many faculty will you need? And all those kind of questions. And the third is how will you assess students, whether they're participating? How will you assess? How will you evaluate faculty, whether the students are liking it or not? And is the program running well or not? So each of these is a big topic in itself. And therefore, I've decided to divide it into three topics. Today, we will focus only on how to construct a case. So any questions related to how to implement this will be taken in the subsequent webinars. So let's move to today's topic, which is construction of a case. So we hope that at the end of the session, you will be able to enumerate the characteristics of a good case, and eventually we have an assignment for all of you where you will have to design at least one case for learning that is appropriate to the learner and the context. So a case, as all of you said, it usually consists of a neutral description of some scenario. Now, ideally, this should be some kind of a real situation or an authentic situation, which requires some kind of an explanation. Now, I'll be using the terms case and problem interchangeably. And this simply means the starting point or the trigger which you're going to use. As you rightly said, it could be a scenario, it could be a picture, it could be a slide, it could be a specimen, it could be any of these. Now, my question to you, the second question is, once you create these cases, where can you use them? How can you use these cases, and where can you use these cases? So please use chat to write, and Sanjay, can you read them out for me?
Okay.
If you're teaching pathology, where are the situations where you can use these cases? Give me real life situations.
Please write on chat.
Yes, we can use them in tutorials. If we have tutorial sessions, we can use them in the tutorial sessions, or in between our lectures when we want to just summarize something, we can just show a case, a video, a case scenario in a video, and then ask students the questions.
Right. Any other scenarios?
Any other situations? Ma'am, just what I have been learning all these years in my professional life is case-based scenarios. Usually we use them in the PBLs, problem-based learning, and there's another tool completely because it stretches over 4 days period, and it involves the entire integration between the basic and the clinical sciences. So I think this is a smaller version of what you are teaching us today, is a smaller version of the problem-based learning. Am I right? Or
I'll come back to you. Anybody else wants to answer where you can use cases?
In the chat, there are a number of, like the case of pleural effusion, give clinical symptoms, scenario, then intro about pathology. Then Thamil Selvi Ramchandran, you can give the case scenario, discuss the disease, then arrive at a diagnosis. What you are going to discuss the topic.
Right.
And also lab investigations. You can introduce the topic, practical classes, and introduce a new chapter to students, and basically, yes, and also these are the responses. And
thank you, Sanjay. So let's go ahead. So where you can use cases are both for learning and assessment. One is if you create a case, you can use it in your classroom to introduce a topic. You can use it in the middle of your lecture, anywhere to make things more contextual. The second thing is you can use it as a teaching method where you have a small group discussion and the discussion is centered using the case. The third situation, which MCI is recommending now, is for integrated teaching, where you can make a case where there are elements of different disciplines. Like if you have a case on rheumatic fever, you can introduce elements of microbiology, and therefore the same case can be used to teach both the microbiological aspects of rheumatic fever as well as the pathological aspects of it. That is the situation. If you are going to teach AdCom, you've seen the modules, there are cases there also which have been used to teach ethical dilemmas and bioethics. So these are the places where you can use cases for learning. For assessment, a case can be used in an OSPE situation. It can be used for spotting. You can use a case as an MCQ, as a scenario-based MCQ. So there are, or as if a case can be an introduction to a structured essay question where you can put a case and then ask students to elaborate on different aspects of it. So how a case can be used as creatively as you want to, but the important thing is that you write a good case. Would you mind if I come back to your question of what is the difference between case-based learning and problem-based learning? It is actually for the next session, but I'll still show you a slide. Now, this is a diagrammatic representation of the difference between problem-based and case-based. So first is you have to look at the control. So when you have problem-based learning, the students are not told previously what the case is going to be. The discussion happens right on the spot. They come to your class and then you give them a handout with a case, a paper case, or whatever you want to give them. And the discussion starts without any previous preparation. In case-based learning, you might tell students that today we're going to discuss anemia, or today we're going to discuss the renal function test or something. So they can read and prepare and come. That is one basic difference between problem-based learning and case-based learning. When it comes to faculty, the faculty in PBL will not do any teaching to the students. So you let the students ask their own questions, formulate their own learning objectives, and go back and find their own answers. And when they come back, if they need some help, only then you help them. There is no teaching involved here. In case-based learning, there is some effort from the teacher to bring students back to track and tell them which direction they need to go. That is about the control over the student, how learner-centric it is. Second is about data seeking. How does the student go and learn? So in problem-based learning, a student will ask for lots of information. So if you say that this is the clinical scenario, the student might say that I want more information about the respiratory system. I want more reports. I want to know the biochemical findings in this case. So the student can ask for information. But here in CBL, compared to PBL, where it is completely open and that case can go in any direction, there is some control where additional data is given in small measures, and you try to restrict the case to a small situation here, so that students can so that the case can be wrapped up quickly. Faculty, on the other hand, they will add some amount of additional data if the student asks for it, and here the faculty will not add any data. Only if it is in the case he can add, or he or she will add the case. Is there any problem here before we go ahead? Any questions?
Please raise your hands. Dr. Rohini. Dr. Rohini Chalekar. Yes, a number of hands have come up. Roshni Jacob.
Roshni, can you hear me?
Yes.
Yes.
Ma'am, it will be more clear if you add an example for both, because I didn't really get what the difference between.
Yeah, I had left this behind because this will come in the next session,
Okay.
where we talk about the mechanics of it. Today, let us restrict ourselves to how to construct the case, because how you conduct a PBL session and how do you conduct a case base is going to be completely different. And let's not divert today. So if that satisfies most of you, you can put your hands down. And today, let's focus on how to design a case. That is a whole topic in itself, and I will start from the beginning next time with the difference and how it started. There is no difference in the case as such. The difference is in the manner you conduct the session. So that will be taken in the implementation aspect. Can I move ahead now? Is it okay with all of you? Okay. Thank you.
Yes.
Dr. Kalpana has raised her hands once again. Yes, Dr. Kalpana.
Yes, sir. I was asking that can we use these cases in the demonstration of histopathology slides?
You can use it anywhere you want. Like if you're doing just slides without a clinical context, it does not make sense. So adding the clinical context will make it more lively for the student. So you use your creativity and use the cases where you want. Right? Okay. So can we move ahead?
Yes.
Yes, please.
So the blueprint for case construction is: how do you plan the case? How do you construct the case? How do you format the case? And how do you prepare for use of the case? Today, we're just talking about the background work which goes before starting the CBL. So first, how do you plan the case? Now, the quality of your teaching depends upon the quality of your case. And the quality of your case depends upon whether it meets the objectives, what is the type of the case, and what is the format of the case. So what do I mean by these things? The first thing, when you plan the case, it should be consistent with the objectives, expectations, and logistic realities of the curriculum. How much time in the curriculum do you have for case-based learning? Do you have enough rooms where you can conduct case-based learning? Okay, and which objectives are you going to handle? So first of all, you look at which year students you are going to teach. Are you teaching undergraduates or are you teaching postgraduates? What is the prior level of baseline level of knowledge, skills, attitudes, and competency that they already have? And where in the course are you going to be using it? Are you going to be using it for learning, or are you going to be using it for assessment? Are you going to be using it in the classroom, or are you going to use it in small group discussions? And then how do you translate theoretical principles into an instructional design? The first thing you do is decide which learning objectives will be taught using cases. Now this means all of you have written competencies, you have written learning objectives. For each chapter, decide how many cases you need. Don't overdo it. Maybe there is one case or two cases per chapter, and which are the learning objectives which are most suited for the case-based learning. So, and which is the common clinical scenario which can provide integration of learning objectives. It makes no sense to make to design one case for one objective. You have to use common objectives and maybe compile 3 or 4 and introduce them, integrate them into one case. So when you sit down, you are integrating and getting 2 or 3 things out of it. All the more better if you can make a case with 2 or 3 chapters combined together. So in the mind of the student is also learning together. So if I am doing something about uremia and I am doing something about hypertension, if I have a case which has hypertension leading to uremia, it is going to teach the student to correlate between different chapters. So remember, these chapters and these disciplines are not watertight compartments. The more you integrate it in your teaching, the more students learn. And when a student learns in the context, they are able to apply it in the same context. So when a patient comes to a student, it doesn't come as a respiratory case or a cardiovascular case. It can be a combination of the two. There will also be a social aspect to it. There will also be an ethical aspect to it. So the more realistic your cases are, having elements of all of this, the more easy it is for the student to apply this. So once you decide which objectives, you have to decide both the clinical scenario and the content which will go into this case. Also, it is important to include the social context, professional attitudes, values, and ethics, which can all go into your case. And then how can other curricular elements from other departments which are teaching parallelly be integrated into this case? So when you come to constructing the case, when I usually say design a case, this is the kind of case which people usually produce. Now, what is the problem with this kind of a case? It's a good case. But when you use it for learning, what happens? Now, what usually happens is when you have, should I give you a moment to read this case? The simple case of a patient with pallor, and you have given the hematological findings, you've given the PS findings, and asked for the diagnosis. So if you're using this case for assessment, it is fine, because there is only one answer to this, right? So it is like a problem solving. So if you're using this for an OSPE or a spotter, where you're given this case there, in that case, it works fine. But when it comes to learning, you're closing the student's mind. You're not allowing him to explore and think about other things. So this kind of a case works best as in a test situation, an assessment situation, but it might not work very well when you want a student to explore a subject more deeply. I'll tell you why. Let's look at another case here. So what is the problem with this problem? Take a moment to read this. You can write on chat, what is the problem with this problem? Are there any responses coming from you?
Not yet. I think people must be writing. Yes. Unclear data. First one has come.
Okay.
Bindu. Then Dr. Roshni Jacob has raised her hand. Yes, Dr. Roshni.
Right. Madam, when you compare the two cases, the first one, as Madam said, it has only one answer to it. But the second one is a real scenario which you encounter at an OP, where the patient comes and explains her difficulties. But then there are a lot of answers to this question, which when we put to the student.
Would you call this a good case?
Not necessarily. If you have only one answer, if you're expecting just one answer, it is not good. But then it opens the mind of the student to think of different conditions which can result in such a scenario.
Right. Let's hear from one person more, and then we can go ahead.
Yes. Heavy written material, Barnick says no lab or radiological findings, more vague. Then on WhatsApp group there are can be an anemia or cardiac problem. Kalpana says it could be a cardiovascular problem.
Okay.
These are the responses.
Okay. So my problem is not with the case being open. An open case is good. My problem is when a student comes to you just after passing first year, and he's probably not gone into the clinics yet, and you give him him or her a case with clinical terms like a dyspnea or fatigue or dyspnea on exertion, dyspnea on rest. This is a difficult case for a student because he's going to get scared with the terminology. The first principle or the first important lesson to write a case is to use normal layman's language. If a non-medico can understand the case, it is a good case. The more technical terms you use, it is not a good case. And we'll come back to why I'm saying that. Right? Now, there are different kinds of problems which can be used for case-based learning. These are the discussion type, the explanation type, strategy type, dilemma type, application type, and multi-level type. I'm just giving you examples of all of these. Now, a discussion problem is a more open-ended this problem, and it describes an authentic clinical situation. Now, this is used when you want learners to explore all the possible causes based on their prior knowledge. So if it is a student who's come to you just after first MBBS into pathology, just look at this case. Should I read it aloud for you? It's called Breathless with Badminton. So, I would suggest read only the first paragraph and leave the second one. That can be given at a later stage. So,
would somebody like to read it?
I'll read it up, it's fine. A 45-year-old man works as a clerk in a boys' hostel. His job is not strenuous, but he comes to his physician complaining of breathlessness on weekends when he plays badminton with his friends. He says he is not able to sleep well unless he props himself up on pillows. He does not give any history of chest pain. He does not smoke or drink alcohol. So here, if you look carefully, there is the age given. There is a clinical context given of what his job is, whether it is strenuous, not strenuous. And then it says that he is usually normal, except when he plays badminton. And then you come on to the clinical aspect where they say that this is his pulse, his respiratory rate, his temperature, and his blood pressure, and what are his findings here. Now, this is a case you could use to explore the basic, this could go anywhere. You could discuss the causes of breathlessness, whether it is a CVS case or a respiratory case, and make the student understand. And then he has to know the normal respiratory rate or the temperature or the BP or whatever it is. And then you also have pitting edema. So I can use this to say, what do you mean by edema, the mechanism of edema, what is happening here, why is there breathlessness, and then I can go on to heart failure if I want to. So this is a case which is more, which has more detail here. It is clinical. But this is a case which can be used for a long discussion because the students can go anywhere they want. But all cases need not be as complicated as this. The other kind of cases are explanation problems. Here, you take a description of a set of phenomena or events, and this is used to explain phenomenon in terms of the underlying process, mechanism, or principle. So you can use these cases to teach them about normal physiology or about pathophysiology. So like this is a simple case. It's called the colored piece of glass. Little Vivan was playing outside his house when he found a piece of colored glass. As he picked it up, its sharp edge cut his finger and it began to bleed. He started crying at the sight of blood. It took some time before someone heard him cry and told his mother. By the time his mother came, his finger had stopped bleeding. So if you look like it, it looks like it's such a simple case. Why should somebody call it a case at least? But here, if you look at it, you can use it to teach what is bleeding time, how much time does it take for the finger to stop bleeding, what is the mechanism of hemostasis, how does normal hemostasis take place. So it's a good trigger to start teaching something basic. Or let's take another example. This is called Raju's accident. Raju, a 12-year-old student, was coming back after school on his bicycle when he accidentally fell down and hurt his right ankle. He quietly went to his room and tried to hide this incident from his mother. But by evening, the ankle started swelling up. It looked red and hot. He couldn't walk without pain, and his mother noticed him limping. Now, this is a simple case which looks absolutely like a daily something which happened, but you can use it to teach the cardinal signs of inflammation. And you don't have to stop there at the cardinal signs. You can go in and ask the mechanism of each. Why is there redness? Why is there swelling? Why is there heat? Why is there pain? So a simple case which did not have too much clinical detail And if you put too much clinical detail, the discussion moves to the clinical part. When you're teaching general pathology, prefer a case which is simple, which makes them ask questions and makes them go into the mechanisms or the pathophysiology. The third kind of case is the strategy problem. In this case, you give a description of a phenomenon and students are asked to solve uh, a problem there. So it's a simple corona pandemic going on. So I thought let's talk about everybody's problem here. Weight gain in lockdown. So the case says that a sales manager who is in his 40s comes to the medicine OPD complaining that he has grown fat during the lockdown. His abdomen appears swollen and he finds it difficult to fasten his belt. His eyelids and the skin around his eyes appear to be swollen too. He has a report from a pathology lab which shows that his serum protein levels are lower than normal. So without giving too much detail, you are now talking about increase in the size of the abdomen. Is it obesity? Is it ascites here? What is happening here to his swollen eyes? The periorbital edema is happening. And what is the cause of all of this happening? What is the mechanism? What are the causes of edema? Where do you have serum protein levels falling? So that if you don't put too much clinical detail, the discussion invariably will move to pathophysiology and general pathology. The moment you put too much clinical detail, it's good for systemic. But when you talk about general pathology, it's preferable that you keep this case as simple as possible, especially in the first and second term when they have not gone to the clinics too much and they don't know too much of clinical. In this kind of a case will probably be more helpful to you. The next kind of problem is a dilemma. So here you give a real life event where the students are left with at crossroads with questions relating to ethics, proper procedure, or correct management. This is a case which says to tell or not to tell. It says a blood donation camp was organized where several faculty and residents donated blood. You are the blood bank officer on duty the next day. You find out from the records that one of the units of blood had to be discarded as it was positive for HIV. Now, will you tell the donor about this finding? How will you go about this? This is a good case to discuss the ethics behind all of this. What is the right procedure? Are you allowed to tell about the case to the donor, about the finding to the donor? Are you not allowed? What are the rules? So this is a trigger for that kind of a case. Or you can talk about this case which says hard work in vain. So where it says that you are an intern posted in the pediatrics department. This morning you had sent samples of 3 newborn babies for coagulation studies. In the afternoon you found out that the laboratory had rejected all the samples as they were improperly collected. So a simple case like this will be a good trigger to say how do you collect samples for coagulation studies. You can move it on to what are the problems, why are samples rejected, what are the proper methods of collection of the samples, what are different anticoagulants used. You can go anywhere you want. So it doesn't have to be too clinical. Something like this can work fine and it will remain in the student's mind for a long time. But if you don't collect samples properly, the baby's sample is probably going to get rejected. What you're more familiar with is the application problem, where the student is expected to apply his previous knowledge and skills and arrive at an answer. So most cases that we have are usually like this, which you use mostly in assessment. So when we move to assessment and scenario-based questions, then we'll talk about cases like this, where you're giving CSF findings and then asking what is the probable diagnosis. They're more close-ended, but here, once the student learns something, you're expecting him to know what the normal levels are of your proteins or glucose in CSF, and then the diagnosis. The next is something most of you are familiar with, which is the multi-level problem. Here, what we're talking about is progressive disclosure. So it's like a real life. You give one part of the case first, ask the person to make a differential diagnosis, then give another part and ask him what kind of investigation would you like to order, then give the investigation results, and then ask them to confirm the diagnosis, and then you again go on to planning the management. You can take it as long as you want. So this is a simple case. We talk about a 55-year-old school teacher with irregular menstrual bleeding, and then she's diabetic and hypertensive. Here the cervix is enlarged, but the cervix is normal, but the uterus is enlarged. So this is a case which is a little open. where you're talking about an elderly woman with both diabetes and hypertension and bleeding. So you can talk here whether it is going towards leiomyoma or whether it is going into going in for an endometrial cancer here, and that is the clinical aspect you do. The second part of the case, you will say that the endometrial biopsy does not show malignancy. There is a hysterectomy done and there are multiple nodules. Third part, you can again show them the gross findings, the microscopic findings. This is progressive disclosure, where gradually you introduce one element after other depending upon what the student asks. So you can use any of these types of cases. So a case or a problem will provide the central focus for integrated learning. It is a framework for discussion. In other words, it functions as a surrogate teacher. It stimulates the use of a wide variety of resources. And when you write a case, remember to include elements of behavior, your social aspects of it, cost effectiveness, professional attitudes, ethics. You can all introduce little words there. So when you construct a case, remember, it's important to introduce relevant and realistic patient information. The case has to be authentic factually. Keep the context in mind. Now, what you will find is if you go on the net, you will find a number of cases which you can use. But don't copy the cases because most of them are from the West. You might be inspired by them, but I would suggest look at those cases and write your own cases, because you know what is more common here, what kind of patients present here. So that is important. When you keep the local context in mind, the learning is always better. Always keep your learning objectives in mind. Don't try to make your case more fancy. The more simple your case is and the more simple language you use, the easier it is for students to understand. So, and every case needs cues. Cues are these typical darkened words here, which the students need to pick up. You don't have to highlight them. Students will pick them up, but the cues have to be there so that the students remain on track. Right? So, writing a case is like the art of telling a story. So, when you tell a story, the learner ko hazam hona chahiye. The learner has to be able to digest the story, so it better be authentic, factually correct, and appropriate for the level of the learner. Think of who you are dealing with. It should definitely be aligned with the learning objectives, and it should attract the learner. It should not be a boring case. If you put too much detail, the student is going to fall asleep there. It's something which looks like realistic. I might encounter the situation tomorrow, and then what will I do? It should have details and be specific to the context. It should be open enough to allow interaction and discussion. If all the answers are there in the case, it is a problem solving. You're not producing Sherlock Holmes, not producing people to solve the mysteries here. You want them to open their minds and explore the subject at hand. And always try to stimulate critical and higher order thinking. So the question of differential diagnosis, how you proceed ahead, what kind of investigations would you rationally order? Suppose the patient is a truck driver. Will he be able to afford this kind of investigations? Talk about cost effectiveness. Those kinds of things have to be put into your case, and this can encourage active learning. So I want you to look at this case and tell me whether it makes any sense to you. You can write in the chat what it means to you. What is this case about? Does it make any sense to you, or is it confusing?
You can write in the chat. Yes.
What do you think this case is about?
Raise your hands.
Ma'am, every line is a different theme.
Every line is a theme. Okay.
Every line is a different theme. I mean, there are different philosophy, too much of mixture, different things.
Okay. Everybody feels the same way? It doesn't make any sense to anybody?
Sharmila says too much of clutter, no continuity or coherence, no correlation.
Okay. Right. So I agree with all of you. I'll just change something. I'm just going to add a title to this. Now read the case. Does it make sense? right? So the moment you add a catchy title, you give it a context, the whole case changes. Okay, so it's important that your case has an interesting name. Don't give away the diagnosis in the title, but it's always fun to have an interesting title which the student will remember, right? So this is my piece of advice there. The principles of effective case design are: the contents of a case should adapt well to the student's prior knowledge. The case, as I told you, should have several cues that stimulate the students to elaborate, and preferably present the case in the context that is relevant. So if you're talking about India, I would prefer cases about tuberculosis, malaria, and anemia than any other syndrome. So present relevant basic sciences concepts in context of the clinical problem to encourage the integration of knowledge. This is an important thing where you always want them not to learn only the clinical problem, but also focus on the basic sciences. If you look at this case here, there is a clinical aspect, but the focus will remain on why this is happening, what is the mechanism of edema in this case, and what are the causes of edema which can be talked about here. It's important how you design the case and how the student integrates basic and clinical sciences knowledge in his mind. A case should stimulate self-directed learning. So if you look at a case, there should be questions arising in a student's mind. In the beginning of this session, somebody told me that there have to be some questions at the end of a case. It's not always necessary. Sometimes a case, if you ask students to sit and say, what do you want to learn from this? If it's a good case, the student will themselves say that I don't know anything about this, I want to go and learn about this. But some cases, if it's something like a strategy case where you want them to formulate a management or a protocol, then you will probably ask them questions. On an application thing, you will add simple questions. So as I said, the case should enhance students' interest and it should match your objectives. So the checklist for you is: once you've written a case, check if the content is right, check if there's a clear connection with the objectives, see if the problem is sufficiently complex, too easy a case and not too challenging. So there has to be some element there which the student already knows, because if you put everything new, it's going to become confusing, and it is like building up on their baseline knowledge. So you think about, has it been designed and formed clearly? Best to show it to some other people and see whether they also think the same way, because you think it's a perfect case, and that when you actually introduce it in class, it doesn't work. And try to introduce things from other disciplines, give links from actual practice, and keep the language very simple. Don't try to make cases which are too long, because you're trying to include too many things together. It will take a longer time for you to taste the case. So the shorter the case, even 3 or 4 lines usually works. So, and remove any irrelevant superfluous information which is not related. Otherwise, they go on a red herring track, and then you're trying to teach them about one thing and they all go on a different track there. So, and think about, is there enough time for studying the relevant learning issues? One case should be enough to finish what one student can learn in one class. Don't put too many learning objectives. So, and is there sufficient time for students to read and come back? So we'll talk about implementation issues later. Any questions at this point?
Please raise your hands or write in chat. Anyone?
Ma'am, are there any resources that we can have for any cases?
There are a number of sites. If you go and look at case-based learning and pathology, there are a number of sites where you'll have it, but most of these are in the West. So if you have the University of Utah, they've got a site. WebPath is a good site. So there are cases, but the important thing is don't pick up those cases directly. Get inspired by them, and what you do is change it to our context. Whatever terminology is there, you modify it. And the reason why we're holding this webinar is that we expect all of you to create these resources. So if at least I can see 60 people online here. So if 60 of you create at least 2 cases each, you have 120 cases here, which all of you can share. And all of you pick a topic and make it, and then it'll be a good thing for all of us to give feedback on each other's cases, and share it with all other pathologists across the country so that they have a
We
good
will
resource
share
to
the
take.
recording and everybody has to make 2 cases.
Yeah, okay.
Even those
Sir,
who are
can I?
not here. Yes.
So actually, in back in Saudi Arabia, when I used to work there, we used to have in our departments 2 or 3 members from the faculty from the same department. We used to sit together. Actually, I think when 2 or 3 teachers they sit together, they can generate a more comprehensive case. Because when an individual faculty, this is my experience, when I used to generate by myself a case scenario, I used to have, maybe there used to be many loopholes in the case which I could not see critically, but when my peers used to evaluate the case, they would point out certain things, and that really used to work wonders. I mean, by the end, we used to have a very balanced and very attractive, as ma'am is explaining all those qualities.
You all are in groups. You can do that exercise online also. And
right. So what I would suggest, Sanjay, is that I completely agree with what she's saying. I didn't get your name.
Shagufta.
Yes, Gupta, what you can do here is sit in your own departments first, talk to your colleagues, and make a case there. And I would suggest not just talk to your pathology colleagues, but also the clinical colleagues. So they will tell you where you are going wrong with the clinical aspect and what you can change there. So from your own departments, first do the discussion and bring a case here. And then here you can look at things from the pathological aspect of it. So here in your small groups, you can evaluate or give peer comments to each other's cases. But first, in your own departments, as Shagufta says, discuss it and with your even with your PGs, even with your residents or your colleagues, and make some cases, and then see how it works. Any other questions? Any other questions?
no hands.
Okay,
yes.
can we go ahead then? Okay.
And they on chat. On chat, there are 2 comments.
Yes.
Which topics are more amenable to case-based learning, and validation of cases and feedback from students are important.
Agree with it completely. Any topic is feasible, but things which need a clinical context are the ones which are most amenable to case-based learning. So it's easy for you to make systemic pathology cases because there is already a clinical context, but it is tougher and you have to be a little more creative to make cases for general pathology. And I would suggest do that because otherwise general pathology turns out to be very boring for students. So I would suggest that each of you try your hand at systemic, and then definitely at one at general pathology. And what was the second question? I forgot. What was the second question, Sanjay?
Second question was a comment that validation of cases and feedback from students is important.
We'll talk about it in implementation because there you need to do piloting of the case. You have to do it in a small group and see whether it works, and then again you give it to the large group. That's how you do it. Okay. So the formatting. Let's go to the next part, which is formatting the case. Yeah. So you have to decide which information will you give to the student first. Are you going to give the case directly as a small case, or are you going to go in for progressive disclosure? And will you give information to the students step by step? And at which point will you introduce specimens, slides, or any pictures? So the last step is preparing for the use of the case. And here, remember that you are not the only person who's going to teach alone. So this is usually done in small groups. So whatever case you produce has to be equally understood by every other faculty. And what we do at our place is, because the number of faculty is restricted and we have very large groups, we also train our postgraduate students, our residents, of how to teach these cases. So what you do is you make a case guide for all the people or the tutors who are teaching. The case guide will include 1, the title, 2, what are the learning objectives of the case, 3, what are the resources that students will use. So you have to give them details of this is from page number here to page number there, or if it's a website, where do you read from? If it's a book, which pages you're going to read. So all that has to be given. And to the teachers, you write the case, You underline the cues or you make them bold. You write the learning objectives so that they know which direction to steer the discussion into. If there are slides or specimens, what do you have to, what are they going to be? And if the discussion moves to something else, then how are you going to change it? So there can be open-ended questions, there can be handouts, there can be articles or notes and references for the teachers and for the students. So when you start, when you've made the case and the case guide, discuss it with the tutors. Now, people usually say, should the tutor be an expert? So no, a tutor need not be an expert in the subject. He should be an expert in the case. So if that is the case, he need not know the whole of pathology, but that case, he must know all the facts about that case. And he must know the art of facilitation, which we'll discuss next time. So this is what I think Shagufta or somebody else mentioned here, that how you have to refine the case by validation, and then you have to pilot it by showing it to other faculty, to other students, and you test it on a small group of students and see whether they are going in the same direction as you think they are. Sometimes they go very tangentially. So the checklist is, you have to see what is the type of problem involved, what are the educational objectives, what concepts are used in the problem, what problem is addressed, what do you expect the student to come up with, what learning issues, what aspects should be analyzed in detail, what resources are to be used, are the resources available, up to date, accessible. So this is something you have to bother. Ek bar bana diya to it should not be like you have left a resource and the website has disappeared, or the update the editions and the page numbers and the information, and see if it is of sufficient depth to challenge the learner. So any more questions here? I'm going to give you all this handout, and if you have a phone, there will be a QR code which is coming up shortly, and you can click the QR code and download this presentation. I'll give it to you. Any questions here? I hope I finished on time today.
So yes, Dr. Sumita.
Yes, please go ahead.
Hello.
Yes.
Hello, ma'am. Am I audible?
Yes.
Yes, you are.
Yes, ma'am. Good evening, ma'am. It was a very nice presentation. Actually, my question is regarding how do we, how do we plan to prepare case presentations for general pathology? Say, for example, if we are teaching necrosis to them,
yes.
How do we, on what basis do we plan to make a case based on necrosis? Because first of all, once, as you said, they would have just finished first year and come to second year. Right. So understanding would be a little difficult, and pathology requires a lot of imagination, right?
Yes.
So for
and there's
example,
no dearth of imagination in pathologists.
yes. So if we have to like prepare a question on necrosis, how do we plan for? I mean, for a case presentation, how do we do that?
Ma'am, can I answer that?
Or is it better that we keep the case presentations only for systemic pathology and not
no, definitely
for
not.
general?
I would love to go into general. Somebody wanted to answer that question. Please go ahead.
Yes, ma'am.
Ma'am,
Yes.
can I? Can we create a scenario of, say, for example, myocardial infarction or liquefactive necrosis in the brain, cerebral infarction, build a case around the case scenario around that, and then you will arrive at necrosis?
Okay. Say similarly for tuberculosis, it would be like, for caseous necrosis, we take up a case of tuberculosis, like that, is it?
Yes.
Right. Or otherwise, you can go in something like a surgeon opened up, he did a laparotomy and he found that there were chalky white lesions over the pancreas. Something as simple as that.
Okay.
It doesn't have to be anything weird. So if you can start off with anything, you just have to use your imagination. And I think Robin's pathology, Robin's the previous editions used to give us good cases. You can use those cases as well. So look around on the net, and I think about it, and you can always come up with good ones.
Okay, ma'am. Thank you so much, ma'am. Thank you.
So I don't see any hands. Yes, one more. Dr. Kalpana. Yes, Dr. Kalpana.
Madam, I was saying that the types of the necrosis, for example, liquefaction necrosis, we can take the brain scenario. For the gangrene, we can have a diabetic case showing the foot gangrene. Like that, we can build up the cases for this. And inflammation also in acute and chronic inflammation. Likewise, we can prepare the cases.
Right. It doesn't have to be anything too difficult. I think somebody's motorbike. Okay. So if there are no other questions, the
Ma'am,
assignment for
please,
you is
just 1 minute.
go ahead.
How do we scan this QR code, because this is new to us?
Okay. What you need to do is to download from Google Play a QR code scanner on your mobile.
Okay, I have it.
We purchased.
You have it?
It must be there already.
It must already be there. Just look for a QR. Just type QR in your apps, and you'll probably get a QR code. And scan this, and it will take you to my presentation. You can download my presentation. I'm leaving it open here.
So, but how can I scan this, ma'am? The application inside the mobile, how can I scan your QR code?
You're listening to the presentation on your mobile?
Yes, ma'am.
Okay, I'll send this QR code across on the WhatsApp group later. Yeah, if that works.
Okay, ma'am. Thank you. Yes, ma'am. Thank you so much.
We can just send the presentation also, I think.
Yeah, the presentation is available, but the important thing is your homework. So what you wanted to do is design. I wrote one. Sanjay says two. So you have one systemic and one general pathology case, and we want it with a complete tutor guide, which means what is the case title, the case learning objectives, which page numbers, resources, all of this there, and you make a good document, a decent document which the whole world can see. Okay, and submit it within 2 weeks on Google Classroom. And this assignment is a mandatory assignment for everybody who's participating in this course. Right? So have you all got this?
We'll try, ma'am. We'll try our best, ma'am.
You can all do it. There's not a big problem there.
Yes. I have uploaded the presentation also. Yes, Dr. Nityanand wants to ask a question.
Go ahead, please.
Yeah, am I audible?
Yes.
Yes.
There are two points. One is, we can have just like myocardial infarction, you can go for necrosis. So the same case can be dealt with when you're dealing with cardiovascular system. And the same case can go for vertical integration when they are dealing, the medicine people are dealing with myocardial infarction. That's one suggestion.
Exactly, sir.
So you can have a case which is very common and can be integrated with various. I hope I'm audible. There's some disturbance. And other Dr. Shagupta's query, even I had, but I had found a solution. If you are having a cell which you are seeing the presentation in the cell, you just have to do a what do you call cam scanner. I mean, scan the slide.
Take a screenshot and it will work.
Scanner slide. Hello.
Take a screenshot and it will work, or otherwise Sanjay has already given it on your
screenshot and take your colleague's QR app and you scan the what do you call the QR code in your cell, so you'll be able to download the document, which can be later transferred to your cell. That's the suggestion I want to give to Dr. Chan.
Thank you. Yeah, I agree with you. I remember when I first learnt about case-based learning, there was this professor from Nepal who talked to me, and he said, we have a case like there's a guy who's driving a scooter and he falls down and he breaks his arm. So in the first year, we use the same case to teach the students what are the different bones in the arm. In the second year, we talk about healing of fracture. And later on in the clinical years, we talk about the orthopedic aspects of using the same case about what happens when a fracture of the arm happens and the bone happens. So you can use
correct.
Okay.
Yes.
So
thank you.
Any more questions? Any more questions? Right. So if there are no questions, please scan this QR code, and there's a feedback form with a very simple 2 questions. No, this is a
Madam,
feedback form.
Can I ask a question, ma'am?
What?
Can I ask a question?
Yes, you can, but
Yes.
just a minute. This is the feedback form. Please fill it up right now, otherwise you'll forget. And there are just 2 or 3 questions there, which you can already fill up. Please go ahead. Ask a question.
Where is the feedback?
Okay, ma'am. Ma'am, I wanted to ask a question on teaching pathology. After taking a class on initial classes on respiratory system, can I give 2 photographs, micro photographs of the gross, of the gross pathology and and the microscopic view of the lung, and give them as a assignment? Can I give that? Is it right to do that?
Yeah.
For
It is
undergraduate
right to
students?
do that. It is right to do that depending upon what you want to do, but it will not give them a time to think about something. When I'm saying case, I'm talking about opening up a student's mind and letting them explore the subject on their own. So after teaching it, when you're using it, the purpose is completely different. What I'm talking about case-based learning is without priming the student to anything else, I'm giving them a case, asking them to explore the various aspects of it. So that is the difference here.
Okay, ma'am. So after taking a class on pulmonary edema, ARDS, etc., so if I give such an assignment, is it right? After giving them a class on that.
It is right if you want, depending upon what you want them to do. You can also use the case before you start teaching anything. We all presume that students will not learn anything until we teach them. When you are completely wrong, they can go and learn on their own. You select the topic which they can learn on their own, and use the classroom time to build in more interactivity. So they learn the basics in their rooms and come back. And you use the classroom time for clearing their doubts. So it's not a passive lecture anymore. But only thing is you have to be more prepared, because the control is there.
That is true. But then having online classes, is it possible for us to do that?
Online,
because,
yes, you can give a case online.
Since we have to cater to 200 students in a single stretch,
what you can do is you can divide the students. You can divide the students into different groups and put one faculty or one resident in charge of the different groups, and there you can have the same case discussing. Because when you have an online discussion, you need somebody to guide the students. So if they learn on their own from each other, but somebody has to keep answering the questions for them there, or if not completely giving the answers, facilitating the discussion. So you can use it, but the usual problem is if you have a group of 200, it's like the classroom where the front benchers answer and back benchers keep quiet. So if you want proper interactivity, the group size has to be small. And we'll talk about these implementation issues in the next webinar. But the next 2 weeks you have to work. I'm not going to work.
Yes. Thank you, ma'am. Thanks a lot.
Right? Sanjay, can we stop here?
Yes.
It's dinner time for everybody now.
I see there are there are no Roshni Jacob. No,
yes, Dr.
there
Roshni.
are
Nobody.
Don't see the feedback form comes when you click on the this QR code. It is there.
You scan this QR code and you'll get the feedback form. Or Sanjay will put it up on the WhatsApp group.
Yes, I can do that.
Yes.
Okay. Thank you.
Thank you all. Thank you. Enjoy your dinner, and sorry for keeping you up so late. Bye.
Bye. It was really wonderful, Anshu, and it was a new. I mean, some on chat it has written early clinical exposure can be coupled with the case-based learning. Yes.
Yeah. Thank you. We can continue this discussion on WhatsApp if you want to. Thank you.
Yes.
Good night.